Is surgery necessary? You be the surgeon and you tell me. So this is the case of a 50-year-old female who presents to your office with a 6 to 12-month history of progressive symptoms. And what she's mostly describing is like a feeling of weakness in her legs. When she's up walking, her legs feel rubbery. She doesn't feel like she can walk. I mean, she feels off balance. She has back pain, but only minimal pain into the legs. She's thus far been through a lot of treatment. She's been to the physical therapist. She's been to pain management and gotten pain injections to her back. She's been to a chiropractor, been on medications, and none of that is helping. You examine her, and she has essentially a normal exam. She has normal strength and sensation. There's no other pertinent history that you gather from her. She did come with an MRI of her lower back to your office, and on that MRI, she's got moderate to severe narrowing of her spinal canal at multiple levels. So she's got moderate to severe spinal stenosis, which is narrowing of the spinal canal, pinching her nerves. So at this point, she's exhausted all conservative measures. She doesn't know what to do. She's got the narrowing of her spinal canal. Would you take this person to surgery? The answer should be no. At this point, her symptoms don't fit. Most people who are symptomatic from spinal stenosis in their lower back, what they describe as pain in their back with pain in the butt cheeks and achiness down the legs, and they can't walk very far because of the pain, because of the discomfort. On the other hand, the way she describes her presentation is she's having trouble with her balance. Her legs feel weak. She doesn't feel like she can walk because she feels weak. So it just doesn't fit. So at this point, what should you be thinking? What you should be thinking is, could she have a pinched spinal cord higher up? So what you should do is order MRIs of the neck and thoracic spine to rule out a pinched spinal cord. You find that that person actually has a pinched spinal cord in their neck. There's actually severe narrowing of the spinal canal in the neck, pinching her spinal cord over multiple levels. She's somebody who needs surgery because if you don't unpinch her spinal cord, she's at increased risk of hurting her spinal cord and being paralyzed. Now, for those of you who did take the patient to surgery to open up her spinal canal in her lower back, surgery went fine. She was discharged from the hospital 2 days later. And then she doesn't show up for her first post-operative visit in the office. And then you find out from your office that the woman has been admitted to the hospital. She was in a car accident and she ended up being paralyzed from the neck down. You see her in the hospital, had a chance to look at her films, and what had happened is they did an MRI of her neck and they found that she had severe pinching of her spinal cord and had bruised and injured her spinal cord, and then ended up having emergency surgery on her neck while she was in the hospital.